cosmetic surgeon, Dr. Basil Pakeman. Welcome to our show.
Thanks for having me.
And of course, we invited you here today to discuss what's new in cosmetic, facial, and body surgery, something that you've been doing for, I guess, over 2 decades?
Pretty close, yes. Over 16 years.
What motivated you to get into this line of medicine?
I would not say it's a particular event or a particular time that actually drew me towards medicine. It's just a natural attraction that has occurred over the years. My first experience actually with cosmetic surgery was really trauma surgery, people after accidents and stuff like that. And that really piqued my interest. Wow. People come in very damaged, and to actually take the different parts and put them back together again.
That's a challenge.
Absolutely is, but it's also an art. Yeah.
I would think. How many procedures would you estimate that you've performed over the past 20 years?
Oh my God, I have never sat down to think about it. There are in the thousands.
A lot.
A lot. This is something I do on a daily basis.
In an article, you recently said that eyes are the biggest bang for the buck when it comes to cosmetic surgery and procedures. How so?
Well, when you meet someone, what's the first thing you notice about them?
You look into their eyes, the mirrors to their soul.
Absolutely. And that's basically where most of the attention usually goes.
Mm-hmm, mm-hmm.
And it does make a big difference. Something as simply as an eye lift, blepharoplasty, does make a big difference. It really can take off years off a person's face.
And I would also think that in today's business world, in order to remain relevant and competitive, you need eyes that don't look like you're tired and getting old.
Well, one of the biggest problems is that we are living longer, we are feeling better, and we feel very good about ourselves, but sometimes our face doesn't match the way we actually feel.
That's true. That's true. So a little nip and tuck there can take how many years off the way you look?
Absolutely. The whole idea here is I do believe in, not starting early, but minor things, over a lifetime. You don't have to go for a big procedure. Nip tucking along the way does make a big difference, and it keeps you looking pretty good throughout the years.
Right, right. And how much of the way you look, such as, and we're going to talk about the eyes, the baggy eyes and things like that, is hereditary, and how much is just working so hard, too hard?
Well, it's really a combination. For some people, it's more heredity versus, environmental factors, but they're all intermixed in there. So the whole idea, guess what? If you don't have great genetics, the thing that you should do is live your life in a healthy way, and, there's cosmetic surgery to fill in the gaps.
What do patients normally want, and generally, what are their goals coming into your office?
Well, at a consultation, I look at it as it's really an interview, and it's an interview in two parts. It's an interview on the patient's part. It's also an interview on my part. We're getting to know each other. Right. For me to understand what a patient really wants and their desire is really, I need to hear it from them. And so it's a give and take situation that goes on, in the consultation. And cosmetic surgery has really grown, and the mass is getting it. It's more routine than years ago. So people coming for all different reasons, from facial surgery, blepharoplasty, facelifts, fat transfer. One of my most popular procedures, believe it or not, is the Brazilian butt lift.
I'm going to ask you about that as we move forward.
Yes.
But while you're on it, explain to us. A lot of people don't know. They've heard it, but they don't know exactly what it is and what the procedure entails. Explain to us what a Brazilian butt lift is.
Well, the whole idea behind the Brazilian butt lift, and the name behind the Brazilian butt lift, is that when we do see a Brazilian woman or a woman on the beach in Brazil, the first thing we think about is the shape of the body, the curves. Well, the Brazilian butt lift is what I would like to think is a surgery that actually is two surgery, but it's really, it gives you a big bang. It's like, it's pretty much like, 1 + 1 equals really 3 and not 2. In this situation, we really sculpt the body. We take fats from maybe the abdominal area, the waist area, could be the inner thighs, the arms, and so we create a nice, slimmer, sleek body, but we do not throw away that fat. Fat is golden, so we take that fat and we transfer it fat grafting transfer, and we inject it into the buttock area, creating a much rounder, fuller shape. It's all about the shapes and the curve. You know, size is not the most important thing. You know, you want to look. It's going back to the old concept of, you know, the golden ratio, and what that really is, we want to, you know, a smaller waist to hip ratio. So therefore, you see the curves.
Got it. Why has, in your opinion, has this procedure become so enormously popular?
Well, if you look around, we have all these stars. We have Jennifer Lopez, we have Beyonce, we have Kim Kardashian, and it's all about the curvy, shapely woman. And so I think that does play into the mass in general.
Okay, sure. What are the different options? Let's go back to the eyes for a second. What are the different options for people that have bags under their eyes or skin drooping over the eyelashes?
Well, we can divide this into two different categories. We can divide it into non-invasive and invasive procedures. So let's start with the non-invasive procedures. And the most common thing we have Botox, we have fillers, being Juvederm, Restylane, Radius, and they all help. For instance, you know, the wrinkles around the eye, you know, the biggest bang you can get is by using Botox, minimize the wrinkles. But we also get a volume loss, you know, look sunken, dark-looking, you know, circles around the eyes, and that's where a filler can actually help. And you know, most fillers, let's say on average, they may last a year, maybe a year and a half. Someone that wants something more substantial, we can look into like fat grafting. Instead of using filler, we can actually use your own natural fat.
That was my next question. Explain to us what fat grafting is while you're on
fat
this.
grafting, I like to think about going green. We're using your natural fat, and it's throwing away, and we're using it as a filler. Yeah. And the great thing about fat, you know, unlike the filler, all these fillers have a longevity to them. Yeah. Fat lasts a lot longer. It could be anywhere from about 3 to 5 years, or even beyond.
Now, if somebody wants to contact you personally, explain to us where your office is and how they can contact you. I know you have a website as well. Explain all that to us.
Well, we're in the office, you know, from Monday to Friday, from 8:30 to 5. Readily available.
Where is it located?
We are located in the Upper East Side of Manhattan. Right. And we're just give us a telephone call. Right. How about drop us you know, an email or text.
Can somebody email you through your website?
Absolutely. Okay. Yes.
And you'll respond to them?
Absolutely.
Okay. Well, I want to say one more time, Dr. Basil Pakeman, 20 years in New York, and of course, your reputation as one of the best plastic surgeons here remains, and we wish you much success in the future.
Thank you. Appreciate it.
It's been my pleasure. Keep up the good work.
Thank you.